Hello everyone and welcome to Health Talk. I'm your host, Kim Beckett. Well, Indian River Medical Center is recognized for top cardiac surgical outcomes in the United States, according to the Society of Thoracic Surgery. They also partnered with Duke. What more can I say? They are a certified stroke center, as well as they received one of the awards for best places to work on the Treasure Coast. These are just to name a few. Weekly, I talk with people with very, very highly qualified medical professionals in this area, and that just doesn't happen by choice or by chance. It takes a team, it takes a village, and let me tell you, we are so fortunate today to have these two wonderful people with us. I have to say that my guests today ultimately contribute to the healthcare of Indian River County, and it's with great pride to introduce you to them. I have with me Mrs. Jan Donlan. How are you today?
Wonderful.
It's so nice to see you. I work with you quite often. And Dr. Dick Milsten, how are you doing?
Very well, Kim.
Nice to see you. Well, let me let everybody know, Jan Donlan is the Vice President of the Foundation and Community Relations for Indian River Medical Center, and Dr. Richard Milsten is a retired urologist from New Jersey, but very involved with the medical care here in Indian River County. Ms. Donlan has been with the Foundation since 2000, and Dr. Milsten did his undergraduate studies at Yale, magna cum laude, medical degree from Columbia University, and trained at Dartmouth and finished his urology residency at the Medical College of Virginia. Wow, need I say more? Thank you so much for joining me. I truly appreciate it.
Thank you for having us.
It's a pleasure.
Jan, let me ask you, can you explain to our viewers exactly what the Indian River Medical Center Foundation does?
The foundation is the fundraising arm for Indian River Medical Center. It raises money to make capital improvements, invest in new technology for the medical center, and to make certain special projects possible. It doesn't raise money for operating purposes. It doesn't keep the lights on at the hospital.
Right. So all of the wonderful equipment and many things that we have at the hospital is what the foundation helps to purchase.
Yes.
Okay. And also, can you talk about some of the purchases that have been made for the hospital by the foundation?
The foundation has been very fortunate to have support from a broad number of people in the community. We've raised millions of dollars in the last 10 years that have allowed us to build a new emergency department at the hospital that includes a clinical evaluation unit, express care as well as acute care, the heart center that you mentioned earlier that is affiliated with Duke University Health System. Things in the past like the Post Chapel, which is so much loved, that's at the entrance to the medical center. And there are a lot of technology improvements the foundation has been able to support. Things like the CT Brilliance simulator in the cancer center, 3D echo technology for special procedures recently, as well as, that's for cardiography, and then HD endoscopy equipment that is for special procedures. So really the foundation has been fortunate enough to invest in almost all areas of the medical center.
That's amazing, because when you think about what a small town, we all think of our lovely, charming town of Vero Beach in Indian River County. It's hard to believe that we have got so many wonderful cutting-edge things going on within our medical center.
That's because we have very, very generous donors and very dedicated volunteers like Dr. Milsten.
That's exactly right. Dr. Milsten, let me ask you, since you are very involved with the Hospital Foundation and the board of directors with the foundation, why do you feel that it is so important that as a community that we support the Hospital Foundation? Particularly, I mean, like if you look at a lot of people, they don't even live here full time. So why in the world would they feel like they have to support their local hospital foundation?
Kim, that's a very important question you've asked. And first I want to thank you for allowing me to join you today, and I commend you for the effort that you make on behalf of all citizens of Indian River County to inform them about matters as important as we're discussing today. Many of our residents, as you know, are part-time. And some of them, unfortunately, still labor with the misconception, they have a misunderstanding that if they become seriously ill and suffer an acute event, perhaps a heart attack, a stroke, maybe a leak from the major blood vessel in our body called the aorta, or an accident, an automobile accident, that they will hop on an airplane, and they will return to the safety nest of their care back home, where they may be familiar with their own hospital and the doctors
Right.
as well. But that's a misconception. We do not move unstable patients. So for example, let's say you were fortunate enough to even own your own airplane, and that airplane was on the runway of our airport, and the engine was running, and your pilot was in the cockpit, and things are ready to go. You will not be on that plane. Your care and your outcome will be determined right here at Indian River Medical Center. Now, in the 4 decades that I've been involved with care of patients, I have yet to see one patient who has ever scheduled a heart attack
That's very
or a
true.
stroke or a leak from their major blood vessel,
Right.
the aorta, or an accident. Those aren't the kind of things we plan for.
Right.
But we have to plan for the fact that they could happen here, and therefore we have to help make sure that Indian River Medical Center has the latest technology,
Yes.
the best facilities to ensure excellent outcomes for our own well-being.
Well, you've made, I mean, your points are amazing, because if you think about it, that's why it's so important, I felt, that the residents of Indian River County hear the story from you guys, because you don't plan heart attacks. And the fact that you can come to Indian River Medical Center and you know that you're going to be operated on by a surgeon that is receiving top cardiac surgical outcomes in the country, I just think that that's remarkable.
It's a wonderful feeling,
It is a wonderful feeling. It's something for all of us to be very, very proud of.
indeed.
Now, why do you feel that the foundation role is so important?
The foundation just plays a critical role, and I have to commend the foundation and particularly its leader,
Yes.
Jan Donlan, for what she has accomplished and what her associates have accomplished, and the residents who have been supportive of the hospital. It's a known fact that on a statistical basis, 1 in 3 of us are going to use the hospital emergency room, for example,
Yes.
this year. 1 in 3.
That's
That-
amazing.
That's an amazing number. And of course, in 2005, the hospital opened a state-of-the-art emergency room. But there's another point that's often overlooked. We have a shortage of physicians nationally. And in order to attract the best and the brightest physicians, we must have the best facilities, cutting-edge technology. And the reason is, if you think about it, doctors spend 8 to 12 years after college
Yes.
acquiring their knowledge and their expertise. And when the time comes for them to locate in a community in the United States, and they nowadays have their choice because there is such a shortage, they will not settle in a community unless there is a hospital which provides state-of-the-art facilities and cutting-edge technology. And I think it's very interesting for people just to think about the fact that prior to May of 1932, if you needed medical care, you had to travel more than 70 miles to get medical care. And much of that
That's
trip was
amazing.
over a 2-lane dirt road. That's incredible.
That is incredible.
But many people say, well, that's 1932. That's ancient history. Well, yeah, that's the old days. Until 2006, right here in Indian River County. If you suffered an acute coronary event, your life depended on getting up Route 95 to either Melbourne
That's
or
right.
Orlando. And that is no longer the case. And what a wonderful feeling.
And that can be the difference between life or death.
It is the
It
difference
is.
between
I know
life and
personally,
death.
absolutely.
And I'm thankful every night I go to bed and put my head on the pillow knowing that if I need care, I'm going to be taken care of by very experienced physicians who have obtained, by the way, some of the finest outcomes,
Yes.
surgical outcomes for heart care in the entire United States.
I know, and it's right here in Vero Beach.
You don't have to leave here for that, Taryn. In fact, I will tell you that if I were out of town and I had a heart condition or I had an aorta, for example, that needed to be repaired, I would make every effort to try to get back here.
Well, I absolutely know I would too, so, and I hope all of our viewers would as well. Well, Dr. Milsten and Ms. Jan Donlan, thank you so much for joining me on Health Talk, and I hope that our viewers have thoroughly enjoyed this segment, and now we all understand how much the Hospital Foundation truly does for the healthcare in Indian River County. Thanks for joining me.